Helen Keller International was established in 1915 with the mission to save the sight and lives of the most vulnerable and disadvantaged. HKI finds out the causes and impacts of blindness and malnutrition through evidence-based programming and research on eye health and nutrition. Since 1990, HKI has been working in Vietnam through the Vietnam Institute of Ophthalmology. In 2014 to 2015, HKI implemented establishing vision entrepreneurs through community-based eye care system in rural communities of Hanoi, Vietnam. This is HKI's first project on presbyopia in Vietnam. The project is funded by Grand Challenges Canada from the Government of Canada. HKI has been working with the Hanoi Department of Health, Hki Quai District People's Committee, Hki Quai District Health Center, and Hki Quai District Hospital in the implementation of this project for more than 1 year. Truong Van Sui is 84 years old. When he was young, like many other farmers in the Hoa Tach commune of Hki Quai District, he used to work in paddy fields and animal husbandry. As he grows older, he and his wife often help the villagers in the commune buy cattle for income generation. In his leisure time, he often reads the newspaper to have more information. In the past, it was difficult for him to read newspapers.
Without eyeglasses, my vision was very blurred. With eyeglasses, it is clear. If I read with my eyes, I cannot read for a long time because of the tears. My vision is clear when I wear eyeglasses. Thanks for the program and the local authority, especially the program implementers. They are very enthusiastic. They are very busy with their work, but they still visit my family. We are very thankful to the health sector and medical doctor for their interest in the community people.
When Soy joined the HKI project, he received a free eye examination and eyeglasses. He can read the newspaper much more clearly and longer than ever before. Being over 80 years old, he did not have the conditions to take care of his eyes. In difficult living conditions and with limited awareness about presbyopia, many elderly people like Soy do not have proper care for their vision. This has an adverse impact on their life and daily activities. Today, Soy comes to Hoa Tach Commune Health Center for an eye checkup after he received his eyeglasses. His visual acuity is much improved. With proper eye correction, he shows satisfaction in being an HKI project beneficiary. Soy is one of more than 4,000 people aged 45 years and older in Hki Quai, Hanoi to receive vision screening. After screening, examination, and refraction, those who suffer from presbyopia and are eligible for eyeglasses are provided with free or subsidized quality eyeglasses. The project is implemented by HKI and Hanoi Department of Health. This is HKI's first project about presbyopia with financial support from Grand Challenges Canada, funded by the Government of Canada for the global initiatives. Establishing vision entrepreneurs through community-based eye care system in rural communities of Hanoi, Vietnam was implemented from November 2014 to September 2015. This project supports setting up a network of collaborators who are systematically trained so that they can conduct vision screenings, awareness raising, and behavior change communication activities for the local people at the project sites. Hki Quai is a district not far from Hanoi Center, but local awareness about presbyopia is still limited. Together with other refractive errors, presbyopia is one of the leading causes of vision impairment for people by the time they reach 45 years old. In fact, when they have presbyopia, elderly persons often accept and stand the discomfort without seeking proper care. Some others are so worried that they buy pre-made eyeglasses in the market. Low-quality eyeglasses do not work on presbyopia, and the user's vision impairment does not improve. Many elderly persons may develop blindness due to their subjective feeling or economic conditions. When informed about the free eye examination, the local people come to the commune health center from early morning. It's hard to describe their joy, encouraging one another to get an examination to know about their eye status and have eyeglasses. In this HKI project, it is estimated that about 2,500 pairs of quality eyeglasses will be provided either for free or with subsidized price. According to the American Medical Association in 2008, 74% of people with presbyopia in Southeast Asia, including Vietnam, do not have access to correction. Quality of eyeglasses is problematic in Vietnam. A randomized survey conducted by VNIO and HKI in Kon Tum province in January 2012 showed that 64% of eyeglasses produced by the local optic shops had incorrect focus, 36% had incorrect pupil distance, and 12% of pairs did not have correct lens as in the description. The villagers are very happy to be provided with eye examination and free or subsidized eyeglasses. In the past, they did not have conditions to access quality health services, including refraction and eyeglass dispensing, or just to go to the market and buy one pre-made pair of eyeglasses. Things have changed now. The people can have quality pairs of eyeglasses and can choose the frame they like.
Trong cái đợt khám mắt miễn phí này chúng tôi
In this free eye examination, we are very grateful to the organizations and medical doctors who come here with our elderly. We are very happy.
Thông qua cái dự án mà khám về cái tật chủ yếu là về tật lão thị.
Through the project providing eye care, mostly for presbyopia for the elderly in Hki district, especially in Hoa Tak commune today. HKI expected that, first, the project's direct beneficiaries of 45 years and above have better knowledge about presbyopia. Second, once they got presbyopia, they should seek for health services at the specialized health facilities to have proper care. Additionally, we also expected that the people in Hoa Tak commune in particular and Hki in general have access to the most professional and reliable eye care services. For example, Hazong Eye Hospital or counseling by the specialists from VNIO. When they have other eye conditions beside presbyopia, the counselors and ophthalmologists can provide the most suitable counseling and refer people with serious eye problems to the specialized health facilities. The eyes are said to be the windows of the soul. They are very important for your life. If your eyes are not properly treated, your vision will be lost. It is an extremely significant loss for every person.
Thì các chuyên gia tư vấn cũng như các bác sĩ chuyên môn sẽ có thể là đưa ra những cái tư vấn phù hợp nhất, đồng thời là có thể là giúp cho người dân này họ mà mắc các tật nghiêm trọng về mắt chẳng hạn thì sẽ được chuyển tuyến để điều trị một cách phù hợp nhất. Bởi vì bạn biết là đôi mắt là cửa sổ của tâm hồn thì rất là quan trọng. Nếu như mà không được chữa trị kịp thời mà họ mất đi cái khả năng nhìn nhận mọi việc xung quanh chẳng hạn thì đấy cũng là một điều thiệt thòi rất là lớn của mỗi con người.
We visit Mrs. Win T. Bin's house in Kong Hua Commune, Hki District to see more clearly the usefulness of using correct eyeglasses for the elderly. Bin is a tailor, a profession that requires concentration of the eyes, where she cannot avoid the age-related eye problem. The older she gets, the worse her vision becomes. Her blurred vision had really affected her work. Since she participated in the HKI project, she is provided with different eye services and free eyeglasses because she qualifies as a social beneficiary. This pair of glasses helps her do her tailoring and threading easily. Then her work seems more smoothly done. Through eye examination and providing free eyeglasses for the local people, we would like to thank the medical doctors, the teams from Eye Hospital and the other health facilities, and HKI as well, for their taking care of our eyes so we can have an easier time completing daily activities and more efficient labor.
Để đảm bảo lâu dài, đi lại thuận lợi dễ dàng, làm việc được tăng sức lao động.
With this presbyopia project in Hki District, HKI cooperates with the medical team from VNIO to provide free eye operations for elderly people whose vision impairment cannot be treated with eyeglasses alone. VNIO's mobile eye clinic appears at Hki District Hospital to perform eye surgery for the elderly people. The patients will experience pre-operative screening in order to have the most appropriate intervention. Mrs. Win T has cataract in both eyes. The disease causes difficulty for her in moving and performing daily activities. All personal activities are consigned to her children. She had an eye operation on her left eye in a private eye hospital with rather high expenses. Her family wanted to have her right eye corrected for comprehensive improvement of her vision, but they could not do it before due to financial concern. When her children were informed of HKI's program for free eye operation in cooperation with VNIO and Hki District Hospital, her family was very happy to take her there for an eye examination. Together with Ms. T, more than 30 elderly patients in Hki District will also have eye operations. HKI staff show their caring and provide counseling to the patients. They understand and share the hardship the elderly face in their life when they later suffer from eye problems. Timely counseling and interventions help the patients have better understandings and feelings, and then help change their behavior in regards to eye care for their own eyes. My family is very happy because we had to spend more than 10 million dongs for the operation of my mother's left eye before HKI intervention. My family was pleased to receive the information about the eye operation today because it provides financial support for us. After screening with necessary laboratory tests, Mrs. T and the other patients received eye operations in the VNIO Mobile Eye Clinic. The ophthalmology surgeons and their team are wholehearted and highly focused on having successful surgeries.
Normally, the costs for an eye operation are very high. However, in this case, our hospital has a funding source to cooperate with HKI in providing eye operations in this vehicle for the people in Hki District. Our work has multiple purposes. First, it is to help the patients escape from blindness with a quality of services as high as that in VNIO. Second, we want to share the burden for the elderly in this rural area, as the patients do not have to pay for anything due to funds from different funding sources. Third, some patients are very old now. This morning, I operated on a man over 90 years old because his children do not have the capacity to send him away for eye care services, so our activity here is very meaningful. Fourth, VNIO, in addition to medical services, we also have a responsibility to provide free medical services for the community and contribute to the elimination of blindness for the patients.
After 2 days of working, the surgeons from VNIO provided free eye operations for more than 30 cases for the people in Hki District. With more than 2,500 pairs of free or subsidized eyeglasses for the people and eye examinations for more than 4,000 people, HKI's first presbyopia project was successfully completed. The Vietnamese have a proverb to emphasize the importance of the eyes. Your wealth relies on your eyes. For the elderly with bright eyes, their quality of life will be better in their daily life, and the burden on the children will be released. HKI's eye care programs are significant and inspiring for the community. With this presbyopia project, there is a sustainable and effective solution in providing eye care for the elderly. The Presbyopia project funded by the Government of Canada helps narrow the gaps in the community-based eye care system, especially for presbyopia. Hopefully, the success of the project will be replicated to the other localities in the country.